Hi everyone, it's Dr. Alexis. I find it so surprising when my female patients come to see me and I find out that they don't track their menstrual cycles or know any of the important details as far as the length of their cycle, whether it's regular or irregular, or any associated symptoms. As biological females, from a very young age, we should be taught the importance of understanding, knowing, and tracking our menstrual cycles. The American College of Obstetricians and Gynecologists in 2015 stated, identification of abnormal menstrual patterns in adolescents may improve early identification of potential health concerns for adulthood. They later went on to say that they identify menstrual cycles as a vital sign. So our menstrual cycles are an important factor of our overall health. All cycling women should keep track of their menstrual cycles, period. We all are in charge of our own health. And having an intimate relationship with your menstrual cycle is taking that very first step. And I know what you're thinking, Dr. Alexis, I have to deal with this thing every month. How much more intimate do you want me to get? And I hear you and understand, but you shouldn't have to deal with your menstrual cycles. There's constant communication that's happening every month. And if you're dealing with unwanted symptoms or some discomfort surrounding your menstrual cycle, then that's your body's way of letting you know that there's something that you should be paying attention to and investigating. That communication should be a two-way street. I'm going to give a brief breakdown of what happens throughout a 28-day menstrual cycle, and then I'll share with you some ways that you can start tracking. For the average 28-day cycle, there are two phases. The first phase is the follicular phase, which occurs from day 1 to 14, and the second phase is called the luteal phase, which occurs from day 15 through 28. In the first half of your cycle, a signal is sent from your brain to your ovaries to start producing estrogen. Estrogen is the dominant hormone of the first half of your cycle, and its role is to build the uterine lining to prepare for pregnancy. And remember, the whole goal of your menstrual cycle is to get you pregnant. As you approach day 14, estrogen will reach its highest peak, and another signal is sent from your brain to your ovaries to stimulate the egg to release from the follicle in the ovary into the fallopian tube in preparation for fertilization from a sperm. This event is called ovulation. Once ovulation occurs, you're now in the second half of your cycle called the luteal phase, where progesterone is the dominant hormone. And progesterone's role is to further strengthen the uterine lining in preparation for pregnancy. The easiest way to start tracking your menstrual cycle is to use an app on your phone, like Flo or Clue, and I'll link those down in the description box. On the day that you start bleeding, you open the app and you hit record. The longer you use the app, the more data points it collects, and it'll be able to better predict when your next cycle will be, when you ovulate, and also give you important information like the average length of your cycles. Every doctor you see, whether for a specific health condition or just a regular check-in, should be asking you about your menstrual cycles. And when they do, you'll have that information readily available. Our menstrual cycles are intricately connected to every process in our body, from our gut health to our cardiovascular system, to our neurochemistry, to our immune health. So every doctor that you visit should be asking you about your cycles. And if they aren't, I encourage you to find one that does. I encourage all of my patients to keep a journal and track what they experience or any symptoms that they have during their menstrual cycle. If they tend to get a migraine headache at a certain time of month, they can mark that down, or if they notice they have increased cravings at a certain time of month, then they can write that down as well. It can be really helpful to know when those symptoms arise so that we can match it up with what's going on in their cycle on that particular day. One of the tools that I use in my practice is called cycle mapping. And it's a lab test that uses urine samples throughout the entire month of a cycle and gives us a really beautiful picture of estrogen and progesterone production throughout the entire cycle. I then take my patient's journal and match up her symptoms with what I see on the map. It's a great way to find the root cause and know exactly what's going on that may be the cause of their symptoms. There are many other benefits to tracking your cycle, especially when it comes to fertility and trying to conceive. As you're tracking, you have a better idea of when you're ovulating and know the best window to try to conceive. When it comes to ovulation, you could also check your cervical fluid, which becomes more of an egg white consistency. And you could track your temperature every morning throughout your cycle. And when it spikes, that's when you know you ovulated. I encourage you to start tracking your cycles every month and to really get in tune with what your body is trying to communicate with you. Make sure to use one of the apps that I've linked below. And if you have any questions, please drop it in the comments. Be sure to hit the subscribe button, like this video, and I'll see you on the next one.